All right, welcome to our webinar on threat modeling. I'm Christian Espinosa, the founder and CEO of Blue Goat Cyber. We have Trevor here as well. And some of our travel plans changed, so I'm doing this from Vegas. I just got married like a few days ago, so it's been kind of a interesting journey. So I'm glad everyone's tuning in. And Trevor is going to be doing most of the talking. You want to kind of go over like what the objectives are, Trevor, and get started?
Definitely. So we're going to look at threat modeling through the lens of what the FDA wants to see, some of the guidances and standards around threat modeling that we like to reflect in our work, and then a little bit about our process, since no two companies, no two people are going to do threat modeling the exact same way. So we like to look at some of our preferred methods to make sure we're covering everything.
All right, rock and roll. Let's dive right into it.
All right. So when we're looking at threat modeling, the first thing that we have to do is essentially figure out what we're going to be modeling. That usually comes in the form of threat diagramming. So we're creating a diagram to represent the product that we are threat modeling and give us a more visual understanding of what can go wrong to it. To make sure that everything is cohesive between different organizations, everything is standardized, there's the DFD3 standard for threat diagramming. That is what we prefer to see. And in general, it is an industry-wide standard. It's always going to be the same. And so it helps someone take an immediate glance, understand what different components are, and they don't have to refer to a legend or anything like that as long as they're familiar with the standard.
Threat diagram from the MITRE playbook that the FDA recommends, as well as MDR, right?
Yes, that's correct. So the MITRE playbook for threat modeling medical devices explicitly calls this out as a good standard to follow. Of course, there are other ones and, custom ways of representing different objects. Sometimes it might not cover every type of object, but in general, it'll cover most cases. It'll cover most devices in a simple and concise way. All right. Threat model diagrams are meant to be a little bit more of a high level. They're focused on the avenues for attack more so than trying to be a perfect representation of the system. Of course, we want them to be very accurate. We want it to reflect every component of the system. We want it to reflect those connections and their purpose. But we are not concerned necessarily about getting into the nitty-gritty details on the inside of the machine. We want to see what can go wrong to it. What can we do to attack that device? And what is the best way to visualize it? So that's where a threat model diagram should come in with that perspective. It shouldn't be focused on perfect accuracy of every single internal component, down to the chips, down to the wires, down to the boards on the device. It should be focused on what can happen to it and what's the best way to convey that information. Now, of course, threats can happen to anything, but we like to focus on entry points into the system as some of the main avenues of attack. This is because these are often a gateway into the device from outside. So an example of this is like a USB or an Ethernet port with external facing interface. As long as someone can interact with it without essentially dismantling the device, it can be thought of as an entry point. This can also cover a wireless interface like Bluetooth, Wi-Fi, something around that nature. All of those are entry points as well. Someone can try to hijack those signals. Someone can try to manipulate connections into there and interfere with the device remotely. I think especially when we're seeing wireless interfaces, the risk can go up a little bit, since then you don't have that same requirement of having your hands on the device. You can be in another room or on the same network, or even sometimes just halfway across the world, as long as the device is on the internet. So when we're looking at this threat diagram, one big thing that we have to be aware of is trust boundaries. Trust boundaries sort of play into those entry points. When we're looking at a trust boundary, that's essentially everything under manufacturer control that we can assume to be safe. So that's internal parts of the device, things that are sufficiently screwed off or blocked with labeling, or you can have a physical lock on them, whatever the process is to make sure that it's safe and secure. You can't tamper with it without evidence. That would fall under the trust boundary. These areas are a little bit less of a concern from threat modeling perspective, since we assume that they are going to be safer. Anything outside of the trust boundary, we can assume to be inherently hostile. So when we're looking at these entry points, usually whatever is connecting into that entry point, we can assume to be a malicious device or a malicious actor. And that's just a general rule with anything for an external interface. Even if a USB interface is only meant to interface with a removable thumb drive for backup of configuration files, could be possible that an attacker takes malware on a thumb drive and uploads it onto the device and then is able to compromise the network through that. So we can never assume that entry points are safe. We always have to assume the worst case scenario to help build out an accurate understanding of what can go wrong.
Is it fair to say a trust boundary is kind of like your house, and the doors and the windows and all those are entry points into the house?
Yeah, that's a great way to put it. So those doors and windows are the edge of the trust boundary. You can assume anyone outside that door is may not have the best intentions. They may not try to, operate with the house in a normal way. You can assume anything inside this house is safe. So the house is safe, your refrigerator is safe. All of these internal components you can assume to be a little bit more safe. Those doors and windows are what you want to be most concerned about. You're not necessarily going to put a lock on every single cabinet inside of your house, but you are going to put a lock on your front door. So when we're looking at diagrams, typically this is in the view of an architecture diagram. So an architecture diagram represents a device. You can look at a device, understand what's going on there. But this can be in a few different ways as well. Swim lane and state diagrams are popular as well. A swim lane diagram is usually meant for a specific data flow or a process. So you see start to finish, end to end, what a process looks like. Easiest example for this is always going to be an authentication flow. So you see the start point where a user enters their credentials, where are those credentials sent to, how are they checked, what token or access token is granted back to the user, and then what are they able to do with that token. So it's great for looking at a specific scenario. It's not always as good for looking at the device as a whole. Another thing that we see with state diagrams, they're meant to look at the device in a single state of operation. So this can be during startup, during power off, just during runtime, whatever the state may be. And of course, this is going to vary per device. Can assume there will be different threats under each of those situations. So it's important not to box into one method of threat diagramming. Each device is unique and each device is going to have different considerations and as a result, different diagrams associated. So this is an example of what a high-level threat diagram can look like. We're concerned about all of the entry points into this air-gapped trust network. Anything inside of here, you can't access from the outside. It's all internal components. But we look at these data flows leaving the trust boundary, and this, it's safe to assume there can be a risk here. So these are always going to be the higher concerns. Of course, we want to make sure that everything is secure. So testing under the assumption, what if you get into the trust boundary? Things of that nature always need to be considered. So as I mentioned before, DFD3 standard can be pretty high level. We're looking at 5 main shapes. So an external entity, that's going to be anything outside of control. That would be a thumb drive you can insert into the device, an actor who interacts with the device. All of these would apply, and that's just going to be the sharp rectangle. Rounded rectangle is a process, so that's running code, scripts. If you have a Lambda function, AWS, anything like that would apply. Data stores are a drum shape. That's anywhere that you have information permanently at rest. Databases are, of course, the easiest example. Configuration files can apply. Just general files on a device can apply as well. Data flows are represented by an arrow. It's important to pay attention to which direction the arrow is pointing. If it's bidirectional or one directional, showing which way the data is flowing and what data is passing through. Finally, we look at the trust boundary. That's just a closed shape with dotted or dashed lines, and that represents anything inside of that closed shape being safe under that trust boundary. All right. There are a couple of frameworks here. So as per MITRE's guidance, the acceptable threat modeling frameworks that we like to see in most cases for medical devices are STRIDE and MITRE ATT&CK. We typically use STRIDE for threat modeling, though this can vary. Threats can be mapped to STRIDE, or STRIDE can be mapped to threats. And it's an important distinction. In most cases, we like to map STRIDE to threats. So if we're looking at an individual problem, we'll say, The issue is someone can access credentials stored in the database. We would say, what are the concerns here? Information disclosure, elevation of privilege. These are some of the threats for Stride. And so we would assign those to the individual threat. The alternative is we can take these threat categories out of Stride, so information disclosure, and think of anything that can happen to the device that would cause information disclosure, list them all under there. This also, in that case where we have database credential theft, that would apply to the same area under elevation of privilege.
Yeah, so Stride is a mnemonic, right? And so it's spoofing, tampering, repudiation, information disclosure, denial of service, and elevation of privilege. So it's like the different lenses we look through when we are going to attack something. Like, can we tamper with the data? Can we mess with the integrity? Can we pretend we're somebody else? Can we take the device offline? Can we change our privileges? And that's the model to kind of give us a lens of which to look at these threats, right?
Exactly. And each threat modeling framework has its different pros and cons. They take different approaches. There's MITRE ATT&CK, there's PASTA, DREAD, all sorts of different threat modeling frameworks, each with its own methodology. But Stride does a really good job at comprehensive coverage that is, of course, essential for a medical device, so that we can consider, based on what happens through Stride, we can get a better understanding of what is going to happen to the patient, what is going to happen to the patient's data, which, of course, with a medical device, patient safety is always going to be the number one concern.
Yeah, and Stride was actually created by Microsoft.
All right. So looking at Stride, there are a few different examples for what can happen. Spoofing is usually just pretending you're something you're not. So you're saying that if you take someone's credentials, we can go back to the database credential theft example. Once you have those credentials removed, if you're logging in as a hospital IT administrator, you are acting as them. So any actions you take are going to be through their lens, and you're essentially spoofing your privileges to be them. Tampering is going to be modification. If we get into that database and we change usernames and passwords so that they are no longer the same, only you know those, now legitimate users can't access their accounts, that would be tampering with information. And so we would explore what different areas you can get in and make changes there.
And that tampering is a big concern for medical devices, because we could tamper with the data, with an in vitro diagnostic system, and cause it to give out a false analysis of a result, really, right?
Exactly. And so that's usually going to be one of the big concerns. Often traditional cybersecurity is broken into confidentiality, integrity, availability. And even that can be used for threat modeling mapping. It's not quite as comprehensive as a little bit more of a fleshed out framework such as Stride, but that is the traditional lens. That's cybersecurity 101. You look at confidentiality, integrity, availability. And so in this case, that's essentially going to be the integrity of results, the integrity of information. You want to make sure that's accurate. You don't want to cause a misdiagnosis. You could say that someone has a disease that they don't actually have, and they could potentially receive a dangerous treatment. Or you could say that they don't have a disease they do have, and then they would miss out on life-saving care. Repudiation is another interesting one. So from the lens of a medical device, it's essentially denying the legitimacy of something. So it could be, if a treatment has been prescribed to a patient, if they have gone through an IVD analysis, you could essentially deny that it actually happened. So you can say, this treatment hasn't happened. They didn't go through with it. There is no evidence of that. That's repudiation, and you're disputing the validity of that treatment. I think information disclosure is probably one of the other big concerns for a medical device. Of course, under HIPAA regulations, and then any of the GDPR or any of the regional regulations on data privacy, it's very important to keep medical information safe for our patients. It's a massive breach of trust if their medical records are disclosed. And so information disclosure is a very sensitive problem. And this is likely one of the more common things to identify during risk analysis and during threat modeling, there are a lot of ways to disclose information, even if it isn't directly related to the patient. An example of this could just be finding a configuration file on a device, and then you're able to read what different database connection strings are, hard-coded credentials, things like that. That information can leverage further attacks. So information disclosure is always a very sensitive topic. Denial of service is also a very important issue with medical devices, especially with a device that can potentially cause life-saving treatment in a very short amount of time. If it's not operational, that can be a pretty big problem. So
Yeah, a good
usually,
example of that is like an IVD system. That in vitro diagnostics takes some sort of tissue or sample of a person and it makes a diagnosis on it. So if someone has sepsis and the device is down or goes down and we don't actually say they have sepsis, their blood is toxic and they could end up dying.
right? And it's especially important with cases like sepsis, where you have such a short amount of time to get accurate treatment. And if you miss that window, you can be in a lot of trouble. So it's really important that especially life-saving devices are kept with really high uptime. They're as close to reliable, perfectly reliable as possible. And so there is not much that takes them offline. So identifying a problem that can just cut out the functionality of a device can be a pretty big deal. Elevation of privilege is essentially access to information or functionality that you should not have. So this can be if you have no privilege whatsoever, you're an unauthenticated user, seeing credentialed information, seeing authenticated functionalities, being able to interact with things that you shouldn't. This can also just be from one level of privilege to another. If you're a normal user, you shouldn't be able to access the administrative dashboard. And if you can, you may be potentially able to elevate your levels of privilege and perform functionalities from a higher level of privilege and a different perspective that could allow you to tamper with something sensitive, change something that could potentially be dangerous. So it's important to make sure that this is all regulated through proper access control. You do not have the ability to step outside of the system. All right. So, as per MITRE playbook for threat modeling medical devices, there are 4 big questions that we have to ask. And a lot of this is already covered by some of the things that we've looked at. So, the first being, what are we working on? That's usually going to be the threat diagramming process. We're trying to understand the device, we're trying to understand what it is, what it's doing, how can we best represent the product. After that, we're moving to what can go wrong, and that's the actual threat modeling part of it. We look at any individual component, process, data store, anything that can happen to the device, and understand all of the bad things that can happen. That is going to lead us into the next step. What are we going to do about it? When we identify a problem, we should be able to identify a solution. Finally, we have to make sure that we did a good job. So after going through that, we want to make sure everything that we did was comprehensive and there was sufficient coverage of everything that we did. So this is probably the area where we see the most back and forth on threat modeling, is some of the key considerations that oftentimes get missed. These are pretty high level. And of course, this is going to be just general stuff. Device specific things can always come up. But these are some of the things that we see most often as missed. So one is taking apart a device. We've had a lot of different situations where there can be a threat. If you dismantle the device, you could potentially access a debug port, change the firmware, and perform malicious actions or get into an internal connection that you shouldn't otherwise have access with. There can be some stories around like secure boot. If we have a device that does not have secure boot enabled, you can't just add it on at the end. It has to be designed with secure boot in mind. So that is a concern where if someone does dismantle the device, they're going to be able to do something dangerous to it. So how can we find a way around that without needing to redo the entire system with secure boot? An easy example for a mitigation there is just going to be tamper-proof labeling. If you have evidence on the device that it has been opened up, it has been modified internally, that is an indication of a breach, and that's an indication you shouldn't use the device. So There can often be a few different solutions to any one problem. It's always going to be device specific. It's always going to be implementation specific. Oftentimes, the device is just going to be welded together. So there is no way to dismantle it without tearing it apart and making it immediately apparent. So there can be a wide range of things you can do to fix a problem. Another huge one that we see all the time is bad coding practices. So this is something that we want to have as a threat due to its prevalence in the real world. We get devices all the time that have vulnerabilities through insecure memory handling or just insecure functionality, lack of data sanitization, hard-coded credentials, things like that. These coding practices can introduce a lot of risk into the device, and it's very important that we catch those. Easiest mitigation is always just going to be education to developers and regular static testing. Static testing can't catch everything. It does a good job at catching a lot of the low-hanging fruit, but it helps get away maybe 90% of these easy problems, with the other 10% having to come in through some more in-depth, specific, targeted testing against individual functionalities. This is something that we like to consider early as possible. So as soon as we start threat modeling, this is something that we think at the front of our minds and discuss with clients. Coding practices should always be at the forefront of your mind for a couple of reasons. First being, it's just very important, and you can introduce a lot of really severe risk through vulnerabilities in the code. The second being, it often takes a long time to fix problems identified through bad coding practices. So when we're threat modeling, we're thinking what could happen and verifying whether or not it does happen. Usually this one does happen. So this one can take a lot of time, oftentimes months even, to fix. So we want to catch it as early as possible and shift that threat modeling process to the left as much as we can to identify these early on. One thing that can often be missed is out of scope components. So a certain component may be out of scope under a risk assessment or a penetration test for one reason or another. Example of this could be an internal debug port. It's out of scope for a penetration test since this is a black box, non-destructive penetration test. Someone would have to pry apart the device and damage it to get into that debug port. So the penetration test is going to call this out of scope. That does not mean that there shouldn't be any consideration around it for threat modeling. What if someone is able to break into that device? What if there is not proper education for the user on how to see whether or not the device has been tampered with? And then they interact with that debug port, they potentially flash on malicious firmware, and that can introduce risk into the system. So even if a component is out of scope in one part of a risk assessment or penetration test, it should still be considered under threat modeling. Now, in the same vein, as we're seeing all the in-scope components, we have to make sure that they are covered in depth. It's not going to be sufficient just to think of 2 or 3 threats that can happen against an in-scope component. Oftentimes, there can be dozens or hundreds of threats that'll happen against a single component. So it's very important to understand for any functionality, for any component, for any data flow, what is everything that can go wrong, and making sure to cover all of that. This is another area that we see all the time is threats are just high level. There aren't many threats against each component. It's just trying to act as a tick list instead of trying to introduce security into the system. And trying to take that checkbox approach, it's not good for the security of the device, and it's not good for the clearance of the device. It certainly increases the risk of a rejection by the FDA and massively increases the risk of vulnerability getting introduced into the system that is not caught by risk assessment and threat modeling activities. Another big one, and this can tie into a whole other conversation, is the threats against the software bill of materials and the supply chain. So the software bill of materials is going to be anything in that source code pulled in as an external library. There are a lot of problems that can happen to components in the SBOM. These can often have extremely severe vulnerabilities that, if left unchecked, can introduce a lot of risk into the system. The FDA specifically is looking for vulnerabilities in the CISA known exploited vulnerabilities list. These are vulnerabilities that are actively exploited in the wild and seen by threat actors to be common methods of breach into a system. This does not mean that these are the only threats that should be considered. Of course, any CVE that pops up in a component of the SBOM is a potential exploit. This does not mean that the exploit is public or necessarily well known, which will reduce the exploitability factor of the vulnerability, but it is still something important to consider. So this is where proper risk analysis comes into the threat. We have to understand, what is the exploitability factor for this? Exploitability factor being essentially, how easy is it to execute this attack? What is the impact if successful? Is it possible to harm the patient? What can we do here? So for any problem identified in the SBOM or identified in the supply chain, we want to have all of these considerations. Another thing that we need to think about is insider threats. This is an especially important one since it's not often easy to test this. You can perform a red teaming exercise to assess your organizational security, but in a short-term engagement through penetration testing, there is no way to actually test what would be the outcome of this. So you have to understand what privilege employees have, who has access to this device, what can they do to the device, what checks and balances are in place to verify changes to the device. All of that needs to go into consideration when looking at what can happen from an insider perspective. Now, the update process is a hot topic with medical devices right now. The FDA wants to see devices that are capable of being updated over the air or through remote service or on-site service. This is very important since if a vulnerability is identified after the fact, you're able to make sure that you can replace the firmware or the software with something more secure, and that vulnerability is designed out of the system. Now, while of course this is great to have that update functionality and the ability to make changes to the system, it needs to be considered from a security perspective as well. If you're doing over-the-air updates, you're going to connect into a network. You can potentially be on the open internet. If you're on the internet, you're much more likely to have attackers try to attack the device. So it is a bit of a double-edged sword, understanding what can happen by introducing a secure update procedure. You can still introduce some risk in and of itself. We want to consider what is everything that can go wrong with that update procedure. From the version control that is storing the updates, how are we making sure that is safe? The source code itself can't be tampered with. How is the update delivery process safe? So how do we make sure that the device gets a safe copy of the code? It has not been tampered with in transit. It has not been tampered with if you're doing on-site maintenance and someone's able to switch it out on the service technician's laptop without them noticing. What verifications are in place to make sure that doesn't happen? So understanding what the update process looks like and then moving from there to derive the threats that can apply to it is very important. Now, this can be tied to many different threats, or it can be a threat of itself, and that's going to be user awareness. Looking at it as a threat of itself, we would just want to see what happens if users are not educated on risk and best practices when using the device. What can go wrong? How can they potentially harm themselves, introduce unsafe environments or conditions into the system? From the other lens, we would look at this as a mitigation. So if we have a problem that can be mitigated by user activity and we were not able to mitigate it through design, we would want to understand exactly what the user has to do to increase their security posture and decrease risk in the device. So user awareness and proper labeling for a medical device are extremely important. Users need to be aware of any risk that they can be exposed to as a result of using this device and how to minimize that risk as much as possible. This is partially a threat in the supply chain, but we specifically want to look at the development environment. Most companies now are using some form of version control, whether that's GitHub or Bitbucket or DevOps, DevLabs, whatever it's going to be. It's very important to make sure that is secure. So oftentimes organizations will have their GitHub repository. It's misconfigured. It's publicly accessible. Someone can look at the source code and try to reverse engineer the product, perform their own testing against it, see how they can compromise it. They may be able to identify hard-coded credentials, going back to the bad coding practices. Or it may just be that anyone in the organization can access their GitHub, even if it is restricted. There's no reason that someone from HR can access that GitHub page. There's no purpose for that. They will not need it. And then if their account is compromised, someone may be able to get into the source code. So understanding security in that development environment, at the version control level. And then, of course, just making sure that developers are well educated on best practices. They understand all of the considerations and standards with the medical device, and that development environment is safe and secure. All of these are very important considerations that are often overlooked. And of course, like I said, this is a general list. This is not meant to be comprehensive for everything that can happen to a device. Every device is unique, and we have to recognize that and be informed on what can happen to the specific use case, to the specific component. So that's part of where all the hard work with threat modeling comes in, is understanding everything that can go wrong to a unique system that you may not have seen before. All right, what's next? Threat modeling is just one part of a bigger overall risk management system. Threat modeling is important. It should be shifted very far to the left, as far left as possible in risk assessment. This is going to be a conceptual exercise, thinking about what can happen and trying to design mitigations into the system. So oftentimes threat modeling, just from a perspective of the concept of a device, can be extremely helpful so that you can build security in. This is security by design is always going to be better than security bolted on after the fact. The FDA explicitly calls out the total product lifecycle, development environment, and security considerations early on as some of the most important steps to take when designing a device. So making sure that threat modeling is done early and often is very important. Threat modeling serves as a starting point for identifying any of the areas of concern, what test cases need to be developed to stem into that penetration test, stem into that risk assessment, understand everything that can come after the fact. Once all of these threats are identified as part of threat modeling, they can be translated into test cases. We can go back to the example of accessing that database and accessing user credentials in that database. We take a look at what is in there. How are we going to test whether or not that's possible? We'll want to have a test case for access through different database injections, such as a SQL injection or no SQL injection. We'll want to see if we can access the device itself and then connect to that database from the internal part of the device. What if the credentials are admin password? We've seen a lot worse before, and it's a very easy way to get into these systems. So this is going to serve as a starting point to verify whether or not threats identified as part of threat modeling are actually possible. If we go through, we test all of these input fields for different injection attacks where we aren't able to identify anything. We get in, we try to access the database, and we realize that it's a randomly generated 32-character password. We're never going to guess that. We're never going to brute force that. So that is a threat that we cannot actually realize. Mitigations are already in place. There's data sanitization on any input fields. There is a very strong password policy for the database. So mitigations are already in place. If we identify it's not the case, then we need to start building those mitigations in. Now, part of the fourth question, did we do a good job, can actually be translated into this testing process and into the risk assessment process. If a threat or a risk is identified during testing and during a risk assessment where we can actually perform an exploit that was not covered as part of threat modeling, that's an indication the threat modeling wasn't good enough. So we should step back, take a break from this testing process, take a break from the risk assessment, and move back to the threat modeling. We have to consider again what can go wrong and try to work through that process with greater coverage. Anytime we're seeing that we're missing something further right in the development cycle, we need to go back and start building security into the device. It's always going to be more of a time saver. It's always going to be more efficient and more effective to go back and design security in. It seems counterintuitive, and oftentimes manufacturers will try to just develop a product, get that minimum viable product out, and design security on later. This can be expensive, this can be time consuming, and it's not always going to be the best strategy. It's oftentimes going to save a lot of time and money to take a break, step back, try to revise the process, and then move through again correct. Any threat identified needs to be tested. So if we're looking at a list of 50 different threats, we should be able to assign 50 different test cases. Having said that, it's not always possible to actually test a threat. I'll go back to the example of an insider threat. Without a full comprehensive red teaming engagement, you can't necessarily test that problem. So what can we do instead? We can talk about mitigations without verifying whether or not it's a problem immediately. See the mitigations, look at it from a policy level, look at it from that conceptual level, and understand whether or not this is going to be effective. It can even be tested just from a unique standpoint of looking at, okay, can we access these GitHub pages from the outside? We take a look, no public repositories. Great. Who has access in the organization to the GitHub repositories? We see, okay, only authorized developers, there are proper checks, you have everything monitored and logged. All right, now we know that things are going in the right direction. Anything that we can test from a risk assessment penetration testing perspective should have a test case, should have that mapping back to the threat model. And anything not, we need to explain why there is no relevant test case as part of that penetration test and what we did instead. So threat modeling is going to always lead into a risk assessment following a proper risk management framework. Once all these threats are identified, we verify what can be actualized, what can't, and then assess the outcome. So if we identify 50 threats and we see that 10 of them are legitimate threats, the other 40 already have mitigations designed into the system, the risk on those mitigated threats is going to be low or none, since there is no way or there's almost no way to actually exploit them. Now, for the 10 threats that we are able to realize, we're able to perform these exploits and identify a vulnerability in the system. What is the impact? It could be fairly insignificant, such as just a banner on a web server that is showing the version of Nginx that's used. As long as that's a secure version of Nginx, it's not really a ton of helpful information. While, of course, that is still not best practice to have information like that disclosed, from a patient harm perspective, from a patient data safety perspective, it's not going to be top of the problem. Now, if we're working on a surgical laser and we find that we're able to get into the system and modify the memory and disable safeguards, that's going to be top of our concern. That risk assessment should identify that as a critical problem immediately, something that everything needs to stop. We need to find a way to design that out of the system. It's very dangerous and that can lead to a lot of harm for patients. So understanding what the actual impact is going to be, how easy it is to exploit these vulnerabilities is a very important step once we have identified what's real and what's not. After this risk assessment is done, it's important to have traceability back to the threat model. So as we do that threat model, we develop these test cases. We should map these test cases back to the threat model. We then look at that risk assessment that we've performed. We should map the outcomes of the risk assessment to those test cases, to that threat model. So you're able to follow the thought process. Again, we'll go back to that database access example. We identify that as a threat. You can get into the database, steal user credentials. We develop a test case for it. We see that it's a default password, so we get in. We are able to realize that threat. We look at it, we assess that risk to be a high. Now, if someone's just looking at the risk assessment, they can follow that traceability all the way back to the initial threat modeling and understand how we decided this was going to be a problem, how we came up with this problem, how we verified whether or not it was the case, and then the final outcome. So all of these processes, all of these documents should be joined together, connected. You can easily follow what is happening. All right. Now, Christian, I want to check in with you and see if you have any thoughts on this process and kind of moving forward in a proper risk management framework after threat modeling, after the risk assessment. What do we want to consider in just the device lifecycle?
I think you hit all the main points. I think the biggest one is moving it as far left as possible. So trying to design security into the system versus bolt on. That is the biggest challenge we see. Most manufacturers come to us at the last minute and they didn't do these exercises, and then it's more costly to try to add this stuff later, and it typically delays the clearance of the FDA or MDR. So this is a lot of education and awareness, and unfortunately, like I think we mentioned on a podcast or something, most software developers don't understand cybersecurity. And like you kind of talked about it, their purpose is to build something that works. Our purpose with these test cases, as you mentioned, is to try to get some unexpected or weird behavior out of the device that it wasn't designed for in order to realize something nefarious. And that's the lens we look at versus the software developers just trying to add the functionality and get, like you said, the minimum viable product complete as well.
Yeah, and that's a good point as far as the development process, since designing security into a system, it's not easy. And any part of a development process is difficult. Creating a secure product is even more difficult. Oftentimes, there needs to be a balance between functionality and security. In a perfect world, security consultants and security experts are going to say everyone needs to have mandatory two-factor authentication and their password needs to be 30 characters long. And we say that to a developer and they go, well, we can't tell our users to do a 30 character long password because they're going to get annoyed. They won't want to use the product. We need to find the middle ground.
Yeah, and that's a good point. Like I just had a conversation with a prospect a couple of days ago, and they were frustrated with a cybersecurity company they hired because that cybersecurity company was recommending all these generic cybersecurity controls for a critical device that a surgeon needs access to. They're trying to tell them they needed multi-factor authentication, and like you said, these long passwords. And it sounds great in normal traditional cybersecurity, but if this doctor can't get into that device because it's too complicated, then what is the risk to the patient, right? So it's a little bit different lens. And I think a lot of people try to look at it from traditional cybersecurity, like you have to do all this stuff, but we look at it like, what is the actual impact of doing those things? It could have a negative impact. Multi-factor authentication is not always necessary, as an example.
Exactly. And even that, when you look at the threat modeling process, that itself can be a threat. We go back to Stride. That's denial of service. What if you do 3 incorrect attempts and it locks you out for 10 minutes? That's really bad to have on a life-saving device. So doctors need to be able to get in quickly, but the device still needs to be secure. So what's the middle ground? We can have a quick PIN on the device. We can have it not connect to the internet, so you can't try to brute force the PIN. There are a lot of things that we can do to get around that. So generic fixes for just general cybersecurity problems aren't always going to work here. That's why considerations for a medical device are so different compared to a typical network or a typical product.
Yeah. I think we're kind of wrapping up the threat modeling here, right? Do you have anything else you want to cover today?
No, I think that's about everything.
It's pretty in depth. I mean, I didn't have to say much. You covered it very, very in depth.
Yeah, well, I definitely don't want to. I don't want any devices to be out in the open and insecure, and so this is kind of the first step, and I think it's one of the most important steps. So, I want to make sure that we're covering it pretty well. I
agree. Awesome. And then I know this is our first webinar. We're doing these monthly. What is our next one going to be on? I forgot, Trevor. Do you remember?
So next, it's going to be looking at some of the risk management processes.
That's right.
Risk management is a very wide topic. There's safety and security risk management, understanding how they go together and understanding how they don't. So next, we're going to look at some of that and talk about the differences, how they blend and how they don't.
Yeah, and this feeds right into that. So makes sense. Cool. All right. Well, thanks for tuning in, everyone. And next month, we'll be talking about risk management, and we'll go from there.
All right. Have a good day.